My name is Tim Lee. I'm the Executive Director for the Texas Retired Teachers Association. And as you heard in the bill layout, there is approximately $768 million being added to our TRS-Care health insurance fund. Thank you, Senator Nelson, for all your hard work on this. And this testimony is going to be very short. I just want to look at every single one of you and say thank you very much for your work that you've done to help fund our TRS-Care health insurance program. I am visualizing people in your districts right now who have asked me to come and say thank you. And so I appreciate all the hard work. I appreciate what Senator Huffman is doing to try and shore up TRS-Care. I want to be clear, this does not solve the problem. Senator Huffman is working on some legislation now that will bring maybe an interim committee together if that legislation passes. And if any of you are interested in that, maybe you'll want to serve on that interim committee. We hope to be part of that process. And we really do appreciate all the work that you put into making this funding available for our health insurance program. Thank you so much.
Any questions? Senator Hancock.
Yes, thank you, Chairman Hinojosa. I know the state's put in significant funds. Is there any, in working together, has there been any movement on looking at improvements that help us so that we're not coming back with the $1.3 billion on your side as far as give and take needs to be on both sides? I know the state obviously has given in this budget. What can you tell me? Share where y'all been willing to give as well?
Absolutely. It's a great question. Right now, about 40% of the total health insurance costs are paid for by the retirees, and the rest are made up by multiple sources. But the biggest of those sources, besides the retiree contributions and premiums, is the state. And obviously, with this large chunk of money, the total portion that retirees are paying for the total program has gone down some. So we all have to come to the table. We agree to that. There were about 9 options that were presented during this session, and I think that the number of options that were presented and the magnitude of change that may exist with those options was probably more than all of us could agree, to make progress on. But we agree in principle with many of those and think that we were making progress. We just sort of ran out of time. So I think that Chairwoman Huffman's desire to create an interim committee will help us be prepared to come back next session with some solid answers to try and resolve this problem.
Because I know we came into this session knowing we were going to have an issue, and it sounds like that while we agreed in principle, there wasn't any resolution. There was resolution on our side, but not on your side on this issue. Even though we knew we were coming to the problem's going to nearly double next time we come back.
Yes, sir.
And my hope is that we agree in more than just principle on a give and take on both sides.
Well, I think that we made significant progress in those discussions.
Just not legislatively.
I think that we just ran out of time. But we were ready to act. But the Senate came up with the funds available, and it seemed like the better approach at the time.
Right, but understand that if we just have simply good discussions next time, we got a $1.3 billion bill that the state's going to have to give again. Is the point I'm trying to make. That discussions are great, but resolutions to me are a much better option when we're looking at a continuing issue financially. So I appreciate it.
I completely agree.
Senator Colcross.
Yeah, thank you, Mr. Chairman. Tim, for years we've been working together, and let me say that I'm so proud of Chair Nelson and her leadership to find this money. And we talk about the state of Texas doing it, it's really the people of the state of Texas shoring up this fund this time. And I want to just reiterate, I thought Senator Hancock's questions were spot on, that our negotiations of revamping the programs, and I'm not saying just for teachers, I'm talking about across the gamut of the programs that we have. We're working on Medicaid, trying to get the federal government to give us some flexibility all the way across. Senator Nelson, as Chair of Health and Human Services, and me as a Public Health Chair, we've always talked about bending the curve and all of those kinds of conversations, and we have to do it next time. I look forward to Senator Huffman's leadership on this, in that running out of time, when we were able to give the money, the negotiations kind of stopped. And we have to, not just for our retired teachers, but for all healthcare plans, we are going to have to do major revamping in the future because there's not going to be the money. Whether we look at Article 2 and its growth right now in Health and Human Services, our retirement programs. It's just going to have to be a two-way street with the people of the state of Texas and the retired teachers and our other programs like ERS. Thank you.
Senator Huffman.
And just briefly, I know this has been said, but I do look forward in the interim to working. There is a bill going through that will have an interim study on TRS-Care, but also TRS Active Care is part of the study. And I think we have to look at how those two systems are related and how we might work on that. Again, I say to the retired teachers, we love you, we want to support you, but this is not going to just be an interim study that is a one-day hearing in the Capitol during the interim where we all say what everyone wants to hear. This is going to be a real dig down and solve this problem. It's got to be solved. And my suggestion to the leadership is next session, don't start out the first week saying we're gonna write the check and pay for this, because I'll say it publicly, it makes it difficult to negotiate. So it's just, I'm happy that we could do it this time and we could give us time to solve the problem, but it's got to be solved, and it's going to take work on both sides to get it done. And you and I have had these discussions. I'm just sort of doing it publicly because I want the retired teachers to hear, and we'll just try to come up with a fair solution. Okay.
Chair Huffman, I think that our association was prepared to go down that road with you and made several. We're ready to work with you on that. We appreciate the work that you've done.
Okay, thank you very much for the testimony.
Thank you so much. Appreciate it.